Hello and welcome back. Today we are diving into a very common and often misunderstood condition, arthritis. Whether you are someone newly diagnosed, a caregiver, or just curious, this video will guide you through everything you need to know about arthritis in a clear and practical way. Arthritis is not just one single disease, it is an umbrella term used to describe over 100 different joint related conditions that cause pain, swelling, and stiffness. It can affect people of all ages, genders, and backgrounds, though it's most common in older adults. The two most prevalent forms are osteoarthritis and rheumatoid arthritis. According to the World Health Organization, arthritis is a leading cause of disability worldwide. Over 350 million people suffer from arthritis globally. It affects everyday activities like walking, climbing stairs, and even holding a cup. The emotional and financial toll can be overwhelming, especially for those with severe forms of the disease. Let's take a closer look at the major types of arthritis. First type is the osteoarthritis, the most common form caused by wear and tear of cartilage. Second form is the rheumatoid arthritis, which is also called RA, an autoimmune condition where the body's immune system attacks its own joints. Psoriatic arthritis, associated with the skin disease psoriasis. Gout, caused by accumulation of uric acid crystals in the joints. Ankylosing spondylitis, a type of arthritis that affects the spine. Juvenile arthritis affects children under the age of 16. Several factors can contribute to arthritis, like age, risk increases with the age. Gender, women are more likely to develop most types except gout, which is more common in men. Genetics, family history plays a key role, especially in autoimmune types. Obesity, adds stress on joints, particularly knees and hips. Injury or overuse, repetitive motion, or trauma to joints can increase the risk. Infections and immune system issues can trigger or worsen arthritis. In arthritis, joint structures undergo inflammation or degeneration. In osteoarthritis, cartilage wears down, leading to bone on bone friction. In rheumatoid arthritis, immune cells attack the synovial membrane lining the joints. In gout, uric acid crystals accumulate in joint spaces. Over time, these changes cause pain, deformity, and limited mobility. The most common symptoms include joint pain and stiffness, swelling around the joints, redness, and warmth in inflamed joints, decreased range of motion, morning stiffness lasting more than 30 minutes, especially in rheumatoid arthritis, fatigue, fever, and weight loss, mainly in autoimmune arthritis. Diagnosis is based on a combination of clinical history and physical examination. Blood tests for markers like rheumatoid factor, anti-CCP antibodies, ESR, and CRP. Imaging tests like X-rays, MRI, or ultrasound to assess joint damage. Joint aspiration for analyzing synovial fluid, especially in gout or infection. Early diagnosis is essential to slow disease progression and prevent disability. Severity is often categorized based on number of joints affected, pain intensity and duration, functional limitations in daily activities, and structural changes visible on imaging. Doctors may classify arthritis into mild, moderate, or severe stages for treatment planning. Treatment aims to relieve pain and stiffness, reduce inflammation, slow disease progression, preserve joint function, and improve quality of life. There is no permanent cure, but proper management can significantly improve outcomes. Here are the main classes of drugs used in arthritis treatment. Non-steroidal anti-inflammatory drugs used to reduce pain and inflammation, like ibuprofen, naproxen, or diclofenac. Analgesics, pain relievers that don't treat inflammation, like acetaminophen or paracetamol. Corticosteroids, powerful anti-inflammatory drugs used short-term, like prednisone or methylprednisolone. Disease-modifying anti-rheumatic drugs, they slow down autoimmune disease progression, like methotrexate, sulfasalazine, and hydroxychloroquine. Biologic disease-modifying anti-rheumatic drugs target specific immune pathways. Example: etanercept, adalimumab, infliximab. Urate lowering agents, for gout. Example, allopurinol and febuxostate. Medication choice depends on arthritis type, severity, and patient tolerance. Medications work best when combined with non-drug therapies, like physical therapy improves joint mobility and strength. Occupational therapy helps adapt activities to reduce joint stress. Weight management reduces load on joints. Hot and cold therapy eases muscle spasms and pain. Assistive devices like canes, braces, and orthotics help mobility. Patients are encouraged to stay active with low impact exercises like walking, swimming, or yoga. Eat an anti inflammatory diet rich in omega 3, fruits, and vegetables. Avoid processed food and excess sugar. Get enough rest and manage fatigue. Limit alcohol and stop smoking. These steps can significantly enhance treatment outcomes. Surgery is considered when conservative treatments fail. Joint replacement. Hips and knees are most commonly replaced. Joint fusion, especially for smaller joints. Synovectomy, removal of inflamed joint lining in rheumatoid arthritis. Surgical decisions are based on pain severity, mobility limitations, and joint damage. If left untreated, arthritis can lead to permanent joint damage and deformity, loss of mobility and independence, increased risk of cardiovascular diseases, depression, and anxiety. And it can also lead to worse systemic complications like lungs, eyes, and skin mostly affected. Now, let's talk about the arthritis in special populations. Children requires early treatment to prevent growth problems. Elderly patients often have multiple comorbidities and reduced treatment tolerance. Women more prone to autoimmune types, hormonal factors play a role. Individualized treatment is key. Chronic pain and disability can lead to depression, anxiety, and social isolation. Sport groups, counseling, and stress reduction techniques like meditation and mindfulness are essential components of holistic care. While you cannot always prevent arthritis, these steps can help protect joints from injury, maintain a healthy weight, stay physically active, get regular checkups if you have a family history, treat infections promptly to avoid post infectious arthritis. Living with arthritis can be challenging, but with the right support and management plan, it is possible to lead a fulfilling, active life. Educating yourself, staying consistent with treatment, and building a support network are powerful tools for coping. To sum it up, arthritis is not just a single disease, but a complex group of conditions that can affect anyone, young or old, active or sedentary. It causes joint pain, stiffness, swelling, and reduced mobility, all of which can significantly impact person's daily life. But the good news is that arthritis is manageable. With timely diagnosis, proper classification of the type, and a comprehensive treatment plan, individuals with arthritis can lead healthy and fulfilling lives. That's it for today. Thank you for watching this video. If you found this video helpful, please like it, share, and subscribe for more medically accurate content. Stay healthy, stay informed. I will see you in the next lesson.